Hi there, it's Heidi here from the First Aid Nest. Welcome to today's video. Today we're going to talk about anaphylaxis. Now, I'm the founder of the First Aid Nest and I am also a clinical nurse specialist in allergy. Obviously a registered nurse for 22 years now, so allergy is kind of my thing. So anaphylaxis is something that I get to deal with, unfortunately, every week. And I've probably given more adrenaline than I've had hot dinners, so I could talk about this subject all day. But the biggest misconception I think about anaphylaxis is that people think that it looks a certain way. We can sort of be led by movies, TV to think that it looks a certain way. It looks like big swollen hives all over your face, swollen lips, eyes swollen shut, the voice sounding a bit funny. And although those things obviously do happen, that isn't necessarily what happens a lot of the time. So anaphylaxis can look very different to how we sometimes perceive it to, especially in children. Adults can have a different allergic reaction each time that they have a reaction. And the blog post attached will give you much more information about the different signs and symptoms. But really what we're going to talk about today is how anaphylaxis can look, how we recognize it and how we respond to it. So anaphylaxis looks like difficult or noisy breathing. Sometimes you'll hear a wheeze. Sometimes you'll just hear a funny noise that just sounds very different. Swelling of the tongue, which actually is not that common. That's not something that happens a lot. A persistent cough. So it usually turns into a wheeze. That is by far the most common symptom that we see, especially in children. Also, it can look like a dizziness, or maybe a young child might just go really pale and floppy, a child that's unable to verbalize, but otherwise an adult might feel really, really dizzy, and sort of they can collapse, and that's the blood pressure dropping. Okay, so all these are signs and symptoms of a severe allergic reaction, which is anaphylaxis. Okay, so that's just another word for severe allergic reaction. People can feel tightness in the throat. Now, with someone that isn't able to explain to you that their throat feels tight, either a young child or someone with disability is not able to verbalize things very easily. Sometimes we can describe it as, do you have bugs in your throat or do you have a stone in your throat? And that's something that tells us whether it's just an itchy throat, which is less of a concern, or a swollen throat, which feels like a stone. So that's a really good way to try and differentiate with a casualty exactly how it feels. They do not need to have previously had the mild to moderate symptoms, which would be hives, swelling of the lips, anywhere on the face and the eyes, abdominal pain, vomiting, those kind of things, or a tingling in the mouth. They're all mild to moderate symptoms. So the person may not have had those symptoms before it went to anaphylaxis. They don't come in any specific order. Everyone's reaction looks different. And while often it does start with mild to moderate symptoms, it doesn't always. So if someone has those mild to moderate symptoms of hives, welts, tingling mouth, abdominal pain, vomiting, swollen lips, face and eyes, all of that is external, okay? Apart from the vomiting and abdominal pain, obviously it's from food being ingested and then the abdominal, the digestive system not enjoying it, your body telling to come out. So if someone has those symptoms of mild to moderate, then we would remove the food, stop eating the food. If it was an insect bite and sting, we would try and remove the sting. If they had an EpiPen or any kind of adrenaline auto-injector, we would source that just to have it just in case. And we would monitor them for 1 to 2 hours, okay? If you're worried, absolutely get into the GP. If their symptoms escalate to ones that we'll talk about in a second, then we would absolutely either give the EpiPen and call an ambulance, or just call an ambulance if they don't have an EpiPen, okay? We can give antihistamine, but remembering that antihistamine is just a comfort measure. It's like paracetamol for a headache. It doesn't actually cure the reason why you have the headache, but it cures the symptom of it, which is the pain. So antihistamine will take down the itch, but it won't necessarily, it can't stop your body from going on to have anaphylaxis. All right, so just because you've given antihistamine doesn't mean you're home and dry. You still have to monitor the person for around about 1 to 2 hours. Obviously, people can react after that if they've had something in their system, but it's much less likely. So if the person has the severe allergic reaction and has the symptoms like difficult noisy breathing, swelling in the throat, a wheeze, persistent cough, abdominal pain and vomiting if they've been stung by an insect, swollen tongue, dizziness, or collapse if it's an adult, or pale and floppy if it's a young child, then the first thing we need to do is call an ambulance if they don't have an EpiPen. If they have an EpiPen, we give the EpiPen, then call an ambulance. Before we give the EpiPen, we need to make sure they're either sat down or laid down. Laid down is the best because this helps the blood pressure. And if someone keeps trying to stand up and move around when their blood pressure is dropping, that's what makes them feel, pale, dizzy, and want to collapse. It's not going to help the blood pressure at all. It's going to make things worse. So we need them to either sit or lay down. Some people may not want to lay down. They may feel a bit funny and they want to sit up. That's fine. We're going to be giving the EpiPen on the outside of the thigh, on that big meaty part on the side of the thigh, right in the middle. And we're going to, once you hear the click, we're going to hold for 3 seconds for an EpiPen. Other auto-injectors have slightly different criteria, but for an EpiPen, it's 3 seconds. That's the most common. And then once we've given the adrenaline auto-injector, we will then call the ambulance, okay? So that would be the role of the first aider. So I hope this has been helpful today. You can read in our blog post more information about this topic. But otherwise, please message us with any questions. Take care.